Olá, bom dia. Bom dia a todos.
Good morning, everyone. Good morning. Let us wait for a bit more, 2 minutes, and we will begin. Okay, thank you. Good morning, everyone. Let us begin our second day. Let us resume the activities of this seminar of our action network on strategies for reducing salt consumption for the prevention and control of cardiovascular disease in the Americas. This seminar is being organized by the Ministry of Health in Brazil in partnership with PAHO. Once again, I'll introduce myself. My name is Lorenza Longhi. I'm a technical consultant of the General Coordination of Food and Nutrition of the Ministry of Health in Brazil. And it's wonderful to have you all back with us this morning. Unfortunately, we're not able to schedule this meeting in presence as we wished, but it's important that we proceed with our work for this network, and maybe we can meet very soon in presence. So yesterday we had important talks about the strategies and policies that have been implemented in our region to reduce salt intake. We saw results of research projects. We received updates from PAHO in Washington about their activities and a few assessment studies. If you were not able to follow yesterday all the talks, or you would like to see something again, the seminar will be available on the PAHO channel on YouTube for the next few days. So this second day is more devoted to the exchange of experiences between the countries that make up the network. Once again, I'd like to thank all the representatives for their presence, because without you, the network would not exist. Once again, we will have a team here that will be responsible for the chat, looking at the questions and answers. And since we are fewer people today, I think we can be more dynamic. Maybe at the end of each presentation, we can already have a Q&A session, or we can ask for more details about something that we would like to know, or something like that. So before I call the first person to present, I will pass the floor very briefly to Eduardo Nilsson. He's going to speak very briefly about the activities that we have for today. Good morning, Eduardo. Good morning, everyone. Good morning, Lorenza. Yeah, so I'd just like to say that to everyone. Good morning to everyone. I'd like to thank you all for the talks that we had yesterday, and we are looking forward to sharing experiences with everyone here this morning. And the exchange of experiences from the countries, that's going to be very good, important to know what everyone does, and maybe based on that, we can come up with actions that can be part of our work plan. So thank you, and good work to us all. Thank you, Eduardo. Well, let me see if Gabriela is around, because I'd like to invite Gabriela Flores from the Ministry of Health of Argentina to say a few more words after she spoke yesterday. We want to know what the Ministry of Argentina has been doing in addition to what she said yesterday, what other strategies they're implementing. So something to keep us up to date. Thank you, Gabriela. Good morning. Let's see, I don't know if you have a presentation or not that you would like to share. Can you hear me well? Yes. All right, so let me share my screen with you. Can you see my screen? Yes. Yeah, we can see it. Gabriela, that's perfect. All right. Thank you. Well, thank you very much. Good morning to everyone. I'd like to share a bit more with you because yesterday I talked about the goals on sodium and in foods, and today I'm going to talk about the policies that we have for the reduction of salt consumption in our country. As I mentioned very briefly yesterday, the policies to reduce sodium in our country began in 2009. The epidemiological scenario that we had at that time was a prevalence of high arterial pressure of 14.6, and deaths by cardiovascular disease represented 34.2% of the deaths and 12.6% of the potential years of lives that were lost. And the scientific experience mentioned that hypertension would explain 62% of the strokes and 49% of coronary diseases. And according to the recommendations of the World Health Organization and different experts, one of the best strategies to reduce hypertension rates was the reduction of sodium intake in the country. At the time, the intake in Argentina was assessed at 11.25 grams of salt per inhabitant per day, much higher than the recommendation of 5 grams. And there were studies in our country that said that between 65% and 70% of the sodium that was consumed came from processed or ultra-processed foods. That was what we had and that we used to begin our policies. So in 2009, we launched the plan Less Salt, More Life. It was a voluntary agreement with the Association of Bakeries, and the first point was to reduce the sodium content in bread, because bread has a broad intake in our country, broad consumption, and there were a few studies that mentioned that 25% of the consumption of sodium came from bread. So we began with that, and agreements were signed with the Association of Bakers, but also with the municipalities and the provinces or states that we have in our country to have agreements with bakeries. And we had a reduction of 25% of sodium in bread products. In 2011, the voluntary agreements were expanded to the food industry. We had 2012 and 2013, and 800 products were contemplated that arrived at the law that was promulgated, the law of 2013, law 26905, which aimed at reducing the consumption of sodium for Argentina population. So we had a regulation, as I commented, in 2017, incorporating the limits that had already been reached, and in the food code for the foods that were being considered. And in 2018, the National Survey on Nutrition and Health assessed for the first time the sodium intake. The previous intake came from studies, academic studies, but they were not practical government research. And so now we assessed that the consumption was 7.8 grams per inhabitant per day. You can see the difference between the moment of the regulation and the moment of the assessment. It was just a year away. It's important to say that the law has other points that I'm going to mention, in addition to the limits on sodium intake and the limits of sodium content in foods. And these limits, although they were incorporated in 2017 in the Food Codex, they were done many years before. And so with that, the policies had actually been promulgated 7 years prior. So the main points of the law are the determination of maximum limits of sodium in foods. You have sanitary warnings. They're placed in salt packages. Research was done to define all this. It's not yet implemented in full. We are waiting for a moment to incorporate that. Actions in restaurants. They need to offer menus that are with foods that are low in salt, and warning signs in menus as well, to remove the salt shakers from the tables and to offer other types of salt to people, and also to change the amount of salt in a packet from 2 grams to half. And what we saw with the team at the time that was working on this was that the little salt packets had 2 grams and people practically used all of them. And maybe they used even more than 1 packet. Since this was a fourth of the size, people would start to get used to use less and less, and they could view a more impactful way to look at the amount of salt that they were using if they used more packets. That's why we wanted to reduce them. And also we had awareness raising campaigns. At this time, they were very strong nationally and also in the states and in the cities. So last year, the actions that we carried out specifically for this policy was to have 3 intersector groups for the reformulation to reduce the sodium content, which is something that I mentioned yesterday. They focused mainly on cheese, snacks, and dressings. There were 2 proposals presented for the National Food Commission to change the Argentina Food Code, and one for the reduction of sodium in snacks, and also snacks that cook cookies, and the other one for dressings that are based in mustard. And there was a collaboration for the sanction of the law 27641 for healthy food. It's a law to have frontal labeling that will allow consumers to be able to identify products with excessive salt according to the parameters established by this nutrient profile model from PAHO, and thus bringing clear information to consumers. And at this time, we are about to conclude the regulation of the law 27641, and that this regulation was confirmed, and we had this healthy food program together with our National Institute for Foods. So the challenges that we have ahead of us is implementation of these warning signs in packagings that are sold and salt packages. They are defined. So Argentina would be the first country in the world to have this type of warning in salt packages. We believe that it's very important. What happens is that this frontal labeling discussion and the work to have a law sanctioned that was hard to incorporate in the food code as well, which is something that I mentioned yesterday, also to incorporate in the code a maximum limit of sodium for some types of cheeses that we have, Quartirolo, Port Salud, and Cremoso, creamy cheese. We want to provide assistance in technical and technological aspects as well in the industry for the reduction of sodium in cheese. We wanted to also train the provincial or state sanitary authorities to follow up the implementation of the law 27,641. And we also need to strengthen the monitoring and inspection of the goals that were reached by means of an equipment to detect sodium in 10 laboratories in provincial bromatologies. We had a tender offer to buy equipment for the states. We want to have conversations with the National Advisor Committee to promote the reduction of sodium intake and to have an update regional goals of PAHO to reduce sodium, because we believe that this way that's going to promote new reductions. We want to compatibilize the new goals from PAHO with the limits that were imposed by the Argentinian Food Code. As I mentioned yesterday, very briefly, the previous goals, we reached all of them except for a few subcategories of foods. And now we have a new horizon in our country. So we need to adjust them so that we can think about these new limits. We want to also assure surveillance to measure the effects of these sodium reduction policies in the population. As brief conclusions, just to finish, as first stage, the voluntary agreements are useful, but it's necessary to have an active role of the state to do that so that the industry cannot self-regulate. The state needs to actively participate to conduce and define and establish the goals, processes, and times. And it's also important that voluntary regulations lead to normative sanctions that support the policies at some point. We should also assure the participation of all the involved actors, the ones that are interested on the theme, like the state, civil society organizations, the universities, and the industry. We believe that it's important to have the industry there as well, because that ensures that they can meet the limitations, that they can follow what is established. And lastly, in addition to the technical skills of the teams, it's necessary to have a political decision and a follow-up by the authorities in the highest levels. Otherwise, it would be impossible to implement a successful policy. Well, thank you very much for your attention. Thank you very much, Gabriela. I believe we can go on with our presentation from Brazil, and then we can have Q&A sessions. Can we do that? Yes, okay, Eduardo, there you go. Thank you once again. Let's see if it works this time, Eduardo, right? I'm going to share my full screen. I think that would be easier, right? Can you see it? Oh, there we go, yeah. Yeah, we can see it now. Thank you, Eduardo. All right. So thank you very much, Gabriela. It's wonderful to speak after Argentina and to show what we're doing and learn from what you've done in Argentina. So here, just to begin with a bit of context, here on the left, we have data from this disease, cardiovascular disease, and the global burden of disease has this information directly for the countries. Many times we don't have access to that, but they do. And you can see that the sodium-rich diets are the ones that represent the most losses in incapacities, those years lost because of death and diseases, not just for the Brazilian population, but for the whole world. And advancing to produce data that are both in terms of deaths and also costs of the disease. For example, in Brazil, you estimate that you have this number of deaths in the country because of the sodium, and that implies a cost not only for the healthcare system, but also a cost for the society, because you have 47,000 deaths from that, and people die early, and they have more diseases, and that also means economic losses for the country. This is very important to build this advocacy around the theme.
At the same time, as we were mentioning yesterday, it is important to monitor the dietary sources of sodium. So in Brazil, from the guide classification that is new, which is based in the industrial processing of foods, so we have seen plenty of changes in terms of the food profiles. unfortunately, with an increased consumption of processed and ultra-processed. At the same time that people are reducing the consumption of fresh and naturally processed foods, together with the cooking ingredients that are prepared to use meals using precisely fresh foods in natura. The proper use of condiments based on salt and kitchen salt has decreased very much in the past decade. And this is all happening at the same time, and it is really important to finish what is a priority for the policies and work in different fronts. This is unpublished data, but it's important to highlight that it portrays well in the timeline what we have in Brazil with the latest data of urinary excretion of 9.33 grams a day of salt in average in adults in their diets, and having a very mistaken idea about the population, because only 2.4% of adults, we believe, they are consuming more salt than they should. So people are getting this wrong. And so this is why I'm highlighting those changes. First, that there is a reduction in the participation of kitchen salt, and particularly other cooking ingredients that could be processed. And at the same time, it has increased ultra-processed and processed consumption as sources of sodium, while the consumption of sodium that comes from fresh foods and minimally processed is relatively stable, which means that we should indeed contemplate all of these, because we have 55% of salt, but in the meantime, almost 40% already processed or ultra-processed. So in this sense, for us, it is really important to work in multiple actions, as I mentioned yesterday, because it is precisely to work in a line to reformulate or reduce the sodium content in these foods, and at the same time incorporate standards that extrapolate salt, but it also includes salt in public purchases like school meals, for instance. So nutritional labeling is really important, and we have the mandatory declaration of salt, which is regulation in Mercosur that is actually internalized. And more recently, the discussion and approval of frontal labeling in foods as well. And at the same time, we cannot forget to work with the communication, like media campaigns, in the reduction of salt, especially considering there is this issue of discretionary salt in the kitchen, but also implying this discussion of processed and ultra-processed as sources of sodium, which is very much aligned with the food guides of Brazil. First, about the guides, we have seen advancements, as you can see, in the industrial processing. And it's not only guidelines for the population and health professionals, but this is actually a driver for policies and public purchases and public programs like the school meals I mentioned. So now we have a recent addition after the approval for the guide for infants under the age of 2. And one challenge we have is to use these guides more and translate them into messages for the population, for training healthcare professionals, and doing social marketing as a strategy to change these behaviors. Here we have some examples of specific messages about the use of culinary ingredients, particularly salt. So many messages are spread around social media. And we have these aspects of the bad side of too much sodium and alternatives to its consumption. And at the same time, we've had a recent advancements on the regulatory agency of Brazil called Anvisa, which is the frontal label, but also carrying information for the consumer about the amount of sodium and the nutritional allegations about the low level of sodium, as we see here in this image. But since the very model that was approved in Brazil is different than the one approved in other countries, which would be the octagon, the triangle is defined by many Brazilian institutions. But it's first important to evaluate what was approved and at the same time amplify this aspect of nutritional information to other food sectors, including restaurants and takeouts and other types of foods. When it comes to food eaten outside of the household, improving communication and training of industries from the small establishments like the bakeries, we have this work together with Anvisa, working precisely on that, spreading good nutritional practices through a guide for food like bread production. And since this is a main source of sodium, we should work on how to do this with less salt, and at the same time learning from the experiences of other countries when having smaller salt shakers or not having salt shakers at all on the table. So this is also important to bring, and our challenge is precisely to amplify it, bringing not only the formal establishments, but also fast food, traditional food, and artisanal food. I mentioned before the program for the food meals, there is a specific nutritional profile that limits the amount of sodium in each meal, which is important because it implies not only in the purchase of foods, but their manipulation, production, and their service to the students. So this allows us to advance more in regulatory policies, especially regarding non-healthy foods inside schools and the marketing of foods, both in public as in private establishments. And also the reformulation of food required a voluntary strategy where we are choosing the foods that contribute to the consumption of salt more in Brazil, and we have biannual reduction targets that are voluntary. And it's always important to maintain a transparent monitoring. Our challenges now, especially with this new scenario of having the international targets and regional targets that have been updated, we should advance and use these targets so they can be reached with a potential that will reach the whole country. And we've had advancements here in the case of this table on the left. We have precisely how much advancement was made in the medium reduction, the mean reduction in the amount of sodium here. But we do have large advancements here precisely on the table on the right that is showing, this one on the left is showing that the restrictive targets, still we need to advance more in terms of reduction because it is important to continue reducing. And we are also working with the monitoring to decide on how impactful these targets are. First, because the industry is offering data about the amount of sodium tons were removed from the food, but there is no health information. So we decided to study and find how this impacts first on the consumption of sodium and second on the Brazilian population's health. So if we're comparing two reduction scenarios, it is important to look at the future because the maintenance of national targets in the adoption of other strategies will have a much lesser impact than predicted, like more than twice if you would adopt the old targets from PAHO and 3 times as much if the smaller targets of the world would be adopted in Brazil. But at the same time, looking at voluntary targets and how they can produce, and there is a large projection of cases of cardiovascular diseases that are preventable, and also deaths, which is an important number. Just to end this part of the evaluation, we are going to have different impacts through different policies, and this is the result we look at the DEC project Adriana mentioned yesterday. It's a possibility not only to show the burden of sodium, but also how much we can advance with different strategies and considering different strategies that will take place simultaneously. So we have in different figures how much the impact of the global targets that are mandatory would be more impactful in Brazil in terms of deaths and cardiovascular deaths. And at the same time that the choice of nutritional warnings, in the case of the front of package, this has more impact than the nutritional factor. And also other strategies that can also complement very well as the campaigns about salt that has less sodium in it, which contributes to implement this aspect of the impact of policies. So in order to end this part, looking at the future, we have adopted the targets by the WHO. We have an accelerated goal for the next 4 to 6 years, including different categories based on the criteria adopted in the beginning, but also looking at the smaller regional and global benchmarks and continuing with the whole evaluation process and the updates. So based on this, we have seen as our success points is the need to continuously reduce It's a gradual and continuous strategy, including those international references and having multiple strategies that are many sources of sodium, work in a strong aspect of transparency, both in criteria as well as monitoring. And finally, use national data to make strategies more effective. And looking ahead, we'll have to include these categories, include the international goals, strengthen the monitoring, the application of this norm and its reach, which is of course always in the horizon, to pursue the mandatory targets in the future, increasing them for restaurants, fast food and food services, and finally continue to evaluate the impact, which is important to follow the dynamics and respond through policies that will bring more effective measures based on the national studies we have. Thank you very much. Thank you, Eduardo. Thank you so much for your presentation. Next, we are going to listen from the Ministry of Health of Chile. Let me see if Andrea is already here. Andrea, how are you, Andrea? Are you okay? Yes, now it's working. Hello. Yes, very well. Good morning, everyone. I am going to present, okay? Let's see if a presentation is going to be okay. I should just mention before my presentation that when I'm done, I will have to be away for a couple of minutes and then I'm coming back to the seminar. I don't know if I will be on time for the final questions. Yes, we can see if there are questions right when you finish your presentation, and then we'll wait for you when you come back, okay? Perfect. Thank you very much. Okay, thank you, Andrea. Please. I'm going to present Good morning once again, everyone. I'm really thankful for being able to represent the Ministry of Health here and also present our advancements in the mark that was established throughout the years for the reduction on the consumption of salt in our population. First of all, I'm going to show you some epidemiological data in terms of obesity in Chile. And as you can see, I'm sorry. And as you can see, I'm sorry, I don't know why this is not working. It's like on automatic, I think, the format I was sent. As you can see in Chile, we're always in the first positions in the ranking. I'm sorry, it's not working here. Can I have just a second here? Let me just, yes, of course, no problem. Andrea, take your time. We're here waiting for you. Maybe there is an effect, an animation you made, Andrea. I'm trying to find out, why don't you advance to the next presentation so we're not any more late? Because I don't really know how to use it. If you can't do it this way, you can save as a PDF file. And then you can select as you speak, but let's see if it works now. Okay, let's see if this works. Yes, let's see. Yes. Yes, now yes. Perfect. Well, as I was commenting before, can you see? No, we cannot see your screen. Not yet. You should share it. I didn't, I'm sorry. Now I can, okay. Yes, now, yes. Now on the presentation mode. Yes, now, yes. Can you hear me well? Can you see it? Okay, continuing. As you can see in the slide here, Chile is occupying the first places in the prevalence of obesity in this data that we see here. And in 2021, we are second. In our population, children under the age of 6, I'm sorry. I don't know how I can apply this effect to all of them. Andrea, why don't you continue with the slides like this instead of presentation mode? Yes, it's better. Yes, perfect. Yes, I think we can see. Yeah, so I'm going to go to the next one. Let's see if you can. Okay, now let's see how we can do this. I think you can see it okay, right? Yes, can this be? Okay. Well, the population under the age of 6, the situation is different. As you can see, nowadays our children under the age of 6, they have a prevalence of around 12.4%, and in the next few years, we'll see how this goes because there is a sustainable increase in obesity throughout the years. And I didn't put this data here, but the projection, according to the statistics department of the Ministry of Health, that until 2030, we'll have a prevalence under the age of 6 of 16%, around 16% is a projection. In our population that is older than 15 years old, in the year 2016 and 2017, the survey has identified a population of 75% that is older than 15 have malnutrition by excess, which is a situation which is very unfavorable when you are talking about the consequences this all could have and contribute in terms of non-communicable diseases, and also risk factors like hypertension. 40% of the population is overweight and 31%, around 31% is obese, 3.4% of severe obesity. When it comes to the suspicion of arterial hypertension, according to the National Authority of Health, from 2016 and 17, we had about 70% of the population older the age of 65 presenting the suspicion of high hypertension. And then we look at this in their educational level, we find a very important social factor. So we concentrate this specifically in the population who has less years of education. So we can see on the left about the graphic, this graph here. When it comes to our food, since we are not eating so well nowadays, the National Survey of Food Consumption in 2010 said that only 5% of the population has healthy eating habits, according to the national agency. So we have more than 90% of the population, which is a very important change of around 8% of the population has a not healthy eating habits, and many of them require drastic changes. So when it comes to the consumption of salt and the excessive sodium, we have 98% of the population in our country having a consumption of salt higher than 5 grams, as recommended by the WHO. There is no difference that is statistically significant. We don't see much difference in the sex nor age groups, but this is a variable change around the nation. When it comes to the consumption of salt, according to sex, we can see how we have women eating less salt than men, but the differences between the year 2010, 2016, and 17 between men has changed slightly, the consumption. There's no significant change really when it comes to the consumption of salt from the National Survey of Health 2009 and 10, in 2016 and 17, and there was no significant change either, 0.4.
Regarding the consumption of ultra-processed foods, something that we had from a document of Barro in 2019, we can see that Chile is first in averages for these ultra-processed foods, and we know that this leads to analysis of certain consumptions of sodium. So according to everything that I showed you, unfortunately, we have not a not very favorable scenario in terms of epidemiology and our nutrition. However, for a few years now, we've had important strategies to change this situation. And it's important to see that before I mentioned the focus that we have now, and yesterday was mentioned by a few presentations, the focus on nutritional plans and public policies to change and lead to integral policies, structural changes, and lectures trying to change this, not only in terms of health, but thinking about the impact on the population that this has. So we're trying to have policies reach the population and also on the individual and family levels. Nowadays, the national policy for food and nutrition in our country has this focus. I didn't mention, but we're also working on food systems that are healthy. So the national policy for food and nutrition has all of these components that you can see that range from humanizing nutrition and promoting the right to proper foods and to strengthen food security, and also improve the configuration of the environment and food systems to promote healthy food, and also to strengthen nutritional tension between the different levels of health, and also to do surveillance on food and nutrition and improve public policies, and also promote citizen participation and social control, and also to improve intersectoriality and other policies. And here, just to show you a bit of what we're doing in Chile, we have a mandatory nutritional labeling on the foods. You have guidelines for that. And this label has all of the nutritional information of the foods, and the information. You have optional components and also mandatory components. Between the mandatory components, you can see the declaration of nutrients. Here we have an example of that. And we also have this declaration of a seal that we have. Sometimes you have to say that if you have a few limits on the foods, you need to put certain things on the label. And in the nutrients, you have sugars, for example, sodium and fats and others. In terms of the optional components of this labeling, we have the definition of the nutritional properties, and they are defined in our regulation and the message, in which you have content of nutrients, a dietary fiber or cholesterol of food, among other nutrients. And when we think about sodium intake, we have foods that are free from sodium, and that corresponds when the portion of habitual consumption has less than 5 milligrams of sodium, or you have a reduction of sodium, or you have the other regulation which says that it's low in sodium. And to say that a nutritional characteristic of a food product, it's only allowed to use sentences and descriptors that you have indications when they meet certain conditions. And here you can see a few examples of how we use that in the label. We also have the law number 20,606, and that was promulgated a few years back, about the nutritional composition of foods and the publicity, and that has three main axes. The first one is this frontal labeling, and that indicates that this food has the addition of sodium, fats, saturated fats, or sugars, and that is higher than the limits established by the Ministry of Health for nutrients that are critical or calories. In addition to this regulation, in order to protect the health of our children, you have a prohibition of a publicity for children of these foods that are higher in the limits that were established by the Ministry of Health, and also of the foods that are higher in the nutritional composition that also go higher the limit, and that is not in the label. I don't know, for example, because you might have foods that are not complete, or they can be in other places, and there are other foods that maybe they're not packaged, but the total nutritional composition are, they go beyond the limits that were established. And in addition to that, you have publicity, and that is also forbidden for children with who are younger than 14 years old. And if you have the limits, you also can't publicize that to children, and you have others as well. A few results that were published very recently in the report about evaluations on this law that I mentioned. As you can see, 88% of establishments that sell food, they met this regulation in 2019, and 89% met all of these regulations in 2020. 92.9% of people say that they understand the information contained in the seals, and 48.1% compare the presence of seals when they buy, and they compare, and 79.1% who compare these labels, they say that there has an influence on the purchase. The assessment of the results of the law done by academics nationally and also internationally, they determined that a reduction on average of 5 to 10% of sodium in the categories of studied foods. So there is a reduction of this critical nutrient. And in terms of the reformulation of foods, we saw a reduction of the content of calories, sugars, sodium, and fats. And there was a reduction of these high in sodium products in particular. And the ones that went higher than 74%, there was a pre-implementation, and 27% post-implementation of the law. We saw the reduction in those cases. Regarding a voluntary strategy to reduce the sodium in bread and bread products, we saw that since 2009, and we have a few things that were before. The average consumption of bread in our country is 86 kilos per person per year. The content of sodium in bread is approximately 800 milligrams of sodium per 100 grams of pan, and the estimate of consumption of sodium per person a day by means of bread is approximately 1.885 milligrams of sodium, approximately 4.6 grams of salt. Based on this, the Ministry of Health, together with bread producers, started working together to come up with a voluntary strategy to reduce sodium in bread. And in 2011, that was consolidated by means of a signature of an agreement to voluntarily reduce the content of sodium in bread and bread products. That was the baseline that I mentioned here, to 800 to 1,000 milligrams of sodium per 100 grams of bread. And a few results that we had in 2015 is that, well, we saw in bakeries that followed the strategy, there was a reduction of the content of sodium in bread to average values of 400, 500 milligrams of sodium per 100 grams of pan. And we saw that half of the bakeries followed the strategy, and they presented results that were lower than 440 milligrams of sodium. That was a voluntary strategy. We did not move towards mandatory strategies as well. That's a challenge that we'd still have to think. Well, in terms of strategies for education, we have these food guides for the population. These are from 2013. We have recommendations as well that are associated with the sodium intake. As you can see, you have foods with less salt, and we also have the recommendation to remove salt shakers from the table, and also to look at labels of foods and prefer the foods that have less addition of sugar and salt. These food guides are being updated. We are in this update process, and we are starting the phases of validation. And there's a more integral view, and we have advanced toward food guides that take into consideration social, cultural aspects, and environmental aspects of nutrition as well. So I think we're going to give a very important step in these recommendations, and we will also have everything in line with our law that I mentioned. And as you can see, this is from 2013. So we still need to consider all of that in our update. We also have a food guide for children who are younger than 2 years old. That also includes a food guide for children until the teenage years, and that update has an update on the knowledge about food, and that focuses on normal food for healthy children. And we also consider children higher than that. And of course, there are guidelines for the consumption of sodium for this group. So a few challenges, main challenges, and future agenda that we have. First of all, we need to keep on strengthening the public agenda in order to reduce the number of foods that are high in critical nutrients that I mentioned in different environments. We need local and national regulations. We need to keep on developing and implementing food guides focused on healthy food systems. And we need to strengthen and continue the strategy to reduce sodium in bread and bread products in order to cover, expand our cover of bakeries, and keep on reducing sodium, and keep on doing surveillance for this reduction of sodium in bread and bread products. That's what I had to say. Thank you very much. And sorry for the inconvenience. Yes, those are the problems that we have nowadays. I had never gone through that. No problem. That was very clear, and we were able to see. I'm going to see if there are specific questions on the chat, questions specifically for Elisa. But Elisa, if we have questions later on, when you come back, we can ask you again. Is that okay? Yes, in 5 minutes, I have to go, and then I can come back, so I can come back later for a round of questions later on. And I can also share the presentation. I can do that. Yes, I remember, I remind everyone that the seminar will be on YouTube. And if you want the presentations from yesterday and today, you can contact us and with Segan team and we can send them to you, okay? Thank you, Andrea. We will see you soon. And I can see Elisa here. Elisa, hi, how are you? I will pass the floor to you now. Elisa from Colombia. Welcome, Elisa. You have the floor now. Thank you, Lorenza. Thank you. Good morning, everyone. It's a pleasure to see names in the little box, names that I already know, and look at the faces. We already know a few of you. It's a pleasure to be here. Can you see my screen? Yes? Yep. All right. Well, I'd like to mention that we never measured in Colombia the sodium intake in a complete manner, but we have estimates. And the sodium intake in the population is approximately 4,000 micrograms. I have a problem with my connection. I will shut off my camera so that you can hear me well. So according to our survey on nutrition that we have here from 2005 to 2015, and what we saw, and Eduardo also mentioned that this process of change that we're having throughout the region, we're losing the productive capacity of foods. And this together with other changes that we're seeing that led to the fact that we're also changing the source of foods that we consume on a day-to-day basis. The graph that you see on the right is that in terms of calories, we had a change on the source, and we had a reduction on the consumption of natural and minimally processed foods. And we had an increase between 2005 and 2015 of ultra processed and processed foods. So this is just to have context of what we're seeing in other countries. And we are seeing that a change in our food pattern. And this, of course, leads to an increase in the consumption of sodium, fats, saturated fats, and sugars. And because of the survey, we were also able to establish, and based on reviews that were done before, we saw that in Colombia, we consume a lot of bread and bread products. We consume that on a daily basis. And in other measures, we have snacks and meat products and fast foods. In general, the use of salt shakers on the table is more for the elderly people, more often in capital cities like Bogota, the capital of Colombia. And as a consequence, this is also due to socioeconomic conditions. The main sources of sodium come from processed and ultra-processed foods and foods in restaurants, and a few sources that are added in food preparation as well. In Colombia, based on all of these results, since 2012, we established a national strategy for the reduction of sodium intake that has these 5 lines that you can see on the slide. And this strategy was thought of 2012 until 2021, which was last year. But because of the reorganization that we had in the healthcare system, and in particular in all of the policies, considering the population and other people, we stopped having particular strategies. We wanted to integrate all of that to what we call a route to keep and maintain the health, which has a focus to change social components in healthcare. So the strategy is kept in these 5 lines, but now we're considering health maintenance. And then I'm going to tell you what were the progress in the first line, which is industry. In 2020, we issued a resolution in which we established mandatory goals in 59 priority food groups. So this first goal was to end and start actually in 2022 and end in 2024. And you can see a few products that are sold in Colombia and what is going to be the value that needs to be established as a second goal in 2024. These goals in many of the products, they are very close to what was established globally in terms of the recommendations to reduce sodium in foods and processed foods. This was a difficult exercise have that, and because of what Gabriela mentioned in Argentina here, you need political will and support to be able to do that. It's not simple to establish mandatory goals with an industry that many times proposes the option of having self-regulation, but we know, and especially in Colombia, we've seen that self-regulation is not enough to meet public health goals that we have.
The second line we have is to work with different schools of cuisine and restaurants, because these are another source of sodium. And here we are working initially, and we have information from 2018 and 2019, and together with the culinary sector, in order to standardize the amount of salt in the recipes and preparations. And this is not often measured. At least it was not before. So we required the standardization from the restaurants, and with some examples of restaurants that are quite famous in the city, we were able to establish a standardization of the recipe and therefore reduce in 10% the amount of salt in these recipes, and the consumers didn't notice, and we had a very important achievement with this reduction, and this is being replicated in other areas in the country, but especially with the cuisine sector. And last year we decided to, since we had to stop our activities due to COVID, we decided to make an effort to have a comeback of the restaurants in a more healthy style. So we would be giving aids to these restaurants that will reduce the amount of salt and provide healthy food. And they would have to prove how their preparation processes are going for the food. And what we want with this is that we get a reduction in the restaurants, so they will have a healthy menu, and this will allow the consumer to have all the information when they will choose where they are going to eat when they cannot eat at home. We're looking at the point of view of providing the information, and we have a frontal label system which is different than the octagon, and it establishes limits of sodium in the processed food. And since we do not have a law to make this mandatory, we have decided that the program of food aid from the state would adopt and avoid for the foods that are being delivered in programs from the state would have less sodium. So this is a work that has been done in the food safety programs that are going to be mandatory. Now it's only voluntary in the country. The line of information, education, and communication requires working with different mechanisms to provide information to the consumer, and this is how to learn with other strategies like social marketing in order to influence the way we deliver the messages and the way we work with communication, and also the way we make more accessible the recommendations that are regarding the use of salt shakers, less salt in the preparation, as well as the reduction in ultra-processed consumption. So we have the food guides that are currently being used in Colombia, the guide for infants and for children as well, have specific messages for the reduction of the intake of ultra-processed foods and to avoid the extra salt in the shaker and to promote, therefore, the guides in different programs and strategies that we have in the country. Finally, I would like to tell you about this exercise we've been doing based on the survey on the nutritional situation. And this is the 24-hour reminder. We verified the consumption of the previous day and then simulate what would happen if this diet would maintain itself, and then how would this affect the targets for reduction of processed food. And we found that the consumption of sodium without measuring the salt, because in this survey we didn't measure the use of salt in the preparations, only the extra salt in processed foods. The average consumption is 1,800 milligrams for the population above the age of 64. And for those who consider themselves consumers that were more regulated in the previous day, the average consumption of salt is 2,000 milligrams. And when we look at the targets for reduction, both target 1 and target 2, we can see how this can affect the reduction in 7% in the consumption in the general population, and more remarkably, the ones who were consuming these foods that were being studied as a priority. There is something that we paid attention to, which was the effect in children under the age of 1. 300 milligrams of sodium is the average, and consumers that said they had consumed the food the day before, more regulated, this is more than 500 milligrams of sodium. And what we see here is that the reduction or the reformulation of these products will lead to a reduction in the consumption of sodium of around 10%. So these are the benefits of doing a simulation. We have this information on the survey of the nutritional situation, which without any doubt is an important advancement, but it's not the only line we should be looking at. We should be reformulating this important information and working in other strategies and looking at other fronts, research specifically for Colombia, the food street theme and restaurants and bread, and all of the strategies of markets that bring so much relevance to achieve a better effect in the reduction in the consumption of salt. What challenges do we have? To continue with this resolution, that we have followed this regulation process, how to do the changes in additives, technologies for production, changes in flavor, and the surveillance in accomplishing these targets, and follow with the implementation of processes and programs of food support. And we should follow with the school meal programs that could implement in the foods that have a label on them in a seal, and this would inform how the whole process of advocacy that took place in the country in the last few years. So at the moment, we have part of this in the negotiations that are still being done. We could continue with the investigation processes because we don't have a survey that looks at the consumption of sodium and salt. So what we are doing is looking at different ways and mechanisms to understand this information, but we have to be content with what we have and advance in all of the process that we are following with the culinary sector of the restaurants to see if this improves in general in the country. We do have regions in the country that consume much higher sodium that I presented, and it's important to reach this region in the country where this problem is taking place. What we have now is to evaluate all of the strategies for reduction and the tools we've been using, and evaluate the compliance with the criteria to receive the labels, and advancing all of the information strategies for the consumer, and advancing the strategies for having healthy restaurants that will allow us to advance in all of the process of reduction, not only of salt, but also what's of interest in public health and the offer that the culinary sector and the cuisine has to offer. That's all. Thank you. Thank you, Elisa. It was very clarifying and very interesting. Thank you. Now, I would like to invite once again Adriana from Costa Rica. And I don't see you, Adriana. Let me see. Okay, hello. Okay, you're there. Thank you very much. Hello, good morning. How are you? Well, yesterday I was talking much about what we've done, so I'm not going to explain too much of that today. And I'm going to show you the data on mortality in Costa Rica. And this data from 2016 shows this population, which is small, only 5 million inhabitants, 5.5 million at the moment. But our first cause of death is due to cardiovascular disease, which affects the majority of the country. And second is cancer. When it comes to the part of morbidity, we do see that the prevalence of hypertension, the most recent data shows is 37%, 37.2 in those older than the age of 20. And as we do know, this is increasing, this is affecting children now. And there is something very important, which is that this prevalence of hypertension, it has maintained itself. It has not been reduced, even though we have been making efforts in the part of the social security system. And we do believe that we should start to implement and make some interventions more serious, as this one here involving sodium. When it comes to diabetes, the prevalence is 14.8%, and there's been an increase. And now, especially with COVID, we have lost control of hemoglobin control. So there has been a little loss of control in this sense. When it comes to overweight in adults and obesity, you can see the figures are very high, and in teenagers, it is 21 and 9.8, and in children it's also high, 20 and 14%. So let's just say this is an important problem that we have in terms of non-communicable diseases. Well, there are some people who already know about this, but for those who are not aware, in the year 2009, we have decided to launch an initiative for cardiovascular disease prevention for the Americas through a group of experts from PAHO. And in 2010, the medical college has committed to support the reduction for lower than 5 grams in the Ministry of Health of Costa Rica in 2011. Thanks to this, we have launched a plan that is national with the target that is similar to the declaration. So for a term of 10 years, which ended last year, this plan includes 4 large areas: the investigation, the baseline, we didn't have any, and we're still missing some pieces, but let's just say that we're completing that in order to advance and deal with all the change in conduct, because now we're going to show you some data that are going to talk about the importance this has, the implementation of strategies with the industry and food services, and surveillance and evaluation of actions. The plan has not been evaluated. We are still having to look at this after its completion. We don't know if we'll have a new plan. This will depend on the new government. But what I do know is that some of these actions are already included in the national strategy that is also being renovated. This is the national strategy of chronic and non-communicable diseases that also ended last year. because it was a bicentennial of the independence of Costa Rica. This is why all of the plans ended in 2021. And now we are renewing the strategy and the action plan we're going to formulate it this year. And another strategy is the reduction that was proposed for a reduction of 15% in the daily intake of salt and sodium. And as you do know, there are other targets here that are associated to the reduction of sodium, like cardiovascular disease, the increase in the blood pressure. In 2013, the program was declared of public and national interest. And part of the team and the work team was named as a healthcare authority, which really facilitated collecting information and data. This is an executive agreement that was published in the official diary of the Union in March 2013. When it comes to the consumption of sodium, we have established this indirectly through the availability of sodium in the households, and we have used surveys on income and expenditure, which is called the Household Budget Survey, which has been published here. And we'll see that, well, since we are currently finishing the analysis of the last survey, the one from 2018, we can find the results we have. In the survey that took place in 2004, when comparing to 2013, we noticed an increase in 15% in the sodium available in the households. This sodium available comes from different sources. At least 60% was coming from salt at the moment, and 27% from processed foods, a third of it. And out of these processed foods, an important part had to do with condiments with added salt. And we can see how these results show in the current moment how there is a trend in consumption of processed foods. And this is not the ideal method. We were able to use this to determine the intake, but it also allowed to have an idea and to be able to work a little faster and do the interventions. And then we have to work in the gold standard, you know, but so far we do not have the resources for these operations. Here we have the study that was made. No, I'm sorry, these are the results of the same study. Showing those values I just showed before and showing how the condiments have doubled in the intake and how the consumption of sodium was also increased due to this methodology. This is the study I was talking about for children and teenagers. So this is where we see that the consumption of these children and teenagers on the educational system, where we see in different age groups how there was a statistically significance when it comes to the consumption of salt. This was by the methodology of the more classic intake. And then you can see how the increase is high. And this mean values will have 3.2 grams, and according to this other methodology. And so we were looking at the sex, if it was affecting the results, and it did. We have here men consuming a little more than women. As we already know, they eat more, so they eat more sodium. And we're also evaluating and looking at overweight and obesity or not. And of course, if they were overweight and eating more, they would be eating more sodium as well. So this is an important factor that does not consider sodium that is added in the dish. And this has led to evaluation, and we have at least 1 gram of salt being added, which is 445 milligrams. We have not advanced any further in these studies, but yes, it is fundamental to work with the whole population because we have high benefits coming from it. Working on this, as we have worked in the sector of the industry, is a public-private alliance through association of the Chamber of the Industry and signed by the Ministry of Health. We start by identifying the groups of foods that have more time in the categories that we would be working to reduce sodium. And these are, let's say, what we identified initially and what we looked at the data from the analysis with the data from the survey and income and expenditure at households.
We renewed the agreement and goals were established, and we had a consensus, and they were based and they were available for PAHO in 2015. But we've also done a few adjustments according to the negotiations with the food industry. This was launched by the Ministry of Health. I showed this yesterday, but currently the level of compliance with the goals are 87%, and this is something that we need to update. But we have not begun to work on this yet. We were waiting for the PAHO goals that were recently published last year. And we had a series of meetings with PAHO Costa Rica to try to move on this theme. In the commitment, we saw a few companies who were committed with this alliance, with this partnership, and there was establishment of sodium content in their products. And so we monitored. It was not a lab, it was really based on the results that were declared in terms of the commitment that they had. And we generated a report that we sent to the Ministry of Health and also to the Chamber of the Food Industry. So I think I showed this yesterday. It shows the milestones of salt reduction strategy in Costa Rica. And here you can see the summary. What I'd just like to add now is that what we did in addition to all of this, I'm not going to talk about all of it, but we had this first multi-center collaborative study that we've done with Argentina, Ecuador, and Costa Rica. And we worked on the knowledge and practices and attitudes related to salt consumption. And that was published. And then we had funding from IDRC to implement a program for the reduction of salt. And then we scaled up this project and we evaluated salt sodium reduction policies and programs. And this was published, and it's not included here, but we are at this moment developing a consumption of salt project, of a reduction of discretionary salt. This was funded by the vital strategies. That needs to be added here, the update for this national strategy. Initially, it was 2021, as I said, but currently we have that for 2030. It was not launched, but we are working on this public policy at the moment. So what are the main challenges in Costa Rica? Well, for me, according to my view, it's to ensure the sustainability of the salt reduction program, because For that, we need to have trained human resources because a few persons who were working on this, they retired, and they were people who were trained. And so now we're going to have young people who need training, and I hope they're actually hired, because since we had COVID, we had a reduction on personnel working on this initiative. And we also need time for them so that we can continue with the actions of the program. And something that was not on the plan, and that was a weakness, was the assignment of financial resources. We saw that human resources were designated by the government, but other resources that were for the execution of all of the actions, research and intervention, they came from research projects. So we need the designation and assignment of the government. We need those resources to keep on doing a few things. And for the new government, because we're going to start with a new administration in May, we needed to think about this as a priority. And here is where we need the support from the network and also from PAHO to put pressure on this in a certain way for our countries, so that the new administration and the new authorities consider this program. Regarding research, the priority would be to estimate sodium intake by means of the gold standard, so that we could have the idea, methodology, or value for sodium intake. Well, regarding the interventions, what are the main challenges? One is monitoring and surveillance for these national goals in prepackaged foods. Not only the monitoring by means of what is seen on the label, but also in terms of direct analysis. We've been working since last year on a first pilot study, trying to come up with a plan, but it's still not established. And so we believe that this should be a commitment. And then an execution for this awareness campaign and education that is based on the national marketing plan. And this plan we are developing with funds from the Save Lives program. It's an adaptation, as I said yesterday, of the regional plan. And what we believe is that at least we can come up with it in a Sentinel site. This is part of the material that we generated with this new plan, with this new funding. This is publicity material in which we can see the main idea that consists in promoting the consumption of fresh products and also the use of what we call herbs, seasonings without added salt. Those are products that increase flavor but without adding salt. And as part of the pillars of this value, we have a heart, but not meaning, love, or it has to do with cardiovascular disease. This is targeted for mothers and children and teenagers. We have different types of slogans that we will validate at this time. We're thinking about March or April to validate our publicity materials. We have 13 different types of materials, and those publicity materials would need to be assigned in networks and billboards and posters, flyers. Basically, that would be it. Another challenge would be the implementation of salt reduction measures in food services. We've been working on this with this Save Lives Fund. We've been studying knowledge and practices of owners of restaurants and cooks in food service establishments in 2 provinces in Costa Rica, 2 out of the 7 provinces. Here, we've been working a lot on this. We don't have strategies yet, but we hope to have proposals for strategies. It's a first exploratory study. We don't have any intervention so far, like Argentina has, or the use of salt that is reduced in sodium, because according to the studies, we've done that for the population, and we know that the sodium reduced salt was very well accepted by the population. And lastly, what we've talked about is to approve and implement regulation for the frontal nutritional labeling of warning in prepackaged foods in a mandatory manner. This is a very important intervention. Costa Rica would have a bill this week in our National Assembly, but this bill was archived the past few days. It was dismissed, and the NGOs are fighting to see if this is put to action again by the new administration. And something that we were not able to advance too much was to work together with the program to fortify salt, because in Costa Rica, we have this fortification for decades with fluor and iodine. It's something that's pending, and we were not able to advance too much. And so this is the current team. A few people were hired by means of these financial resources. And after the funding ends, the team will be reduced. So thank you very much for your attention. Thank you very much, Dr. Adriana, for your update. Thank you so much for that. We are a bit ahead of time, so I'd like to ask you if you have any questions for any of the presenters, any of the speakers. Would anybody like to ask a question? Otherwise, I suggest that we have a 5-minute break so that we can continue with the next few countries. What do you think? Do you have any questions, or can we do it like that? Oh, here we have a question from Nadia Flexner to Gabriela from Argentina. Nadia asks if you've experienced any action from the industry in the current process to regulate the labeling law. How are you going to complement the warnings that you mentioned with the octagons? Is the idea to have them together? Gabriela, are you there? Was the question clear? Because I read it in Portuguese. No, I did not understand the first part very well. If we've experienced actions from the industry in the regulation of the law, I don't know if you're referring to the intervention from the industry or pressure from the industry. The regulation of the law was done in closed doors, and it was guided by the Secretariat of Access to Health. And we met with all of the interested parties, with the Ministry of Agriculture and Fisheries and Productive Development Ministry and Education. And because the law talks about the prohibition of the commercialization of the schools and in educational spaces, but in primary school and secondary school, they have this prohibition. And if public purchases are not forbidden per se, there is a recommendation to buy that and prioritize, and they need to provide explanation if it is not possible. And there is a prohibition of publicity. As I said, we met with the different ministries, and we also met with universities and civil society, and there was a meeting with the industry, but very last minute. So the regulation law was basically ready, and at this time they had legal work done to be able to publish that. And actually there were a lot of requests from the industry, but the law was very clear. There were many requests to change the profile of nutrients and for them to have a few exceptions made. But there was a very strong leadership and a very big commitment, both from the Minister of Health, Dr. Carla Vissotti, and also the President, that allowed us to work on the law in very much closed doors and with a clear leadership for health. Regarding the warning signs, they're not going to go together because those health warnings are for packaged packagings of salt, and those is done just like you have the profile of nutrients from Barro. And so to have the seal of excessive sodium, like in sugar, it's like culinary foods. So the warnings, the caution notes, I don't have here to show you, but this caution sign is similar to those signs in cigarette packages, in which you see that the excessive consumption of salt increases blood pressure. And so this would be one of the messages, for example. But at this time, we were having the implementation of the labels, and that was a discussion that took a long time. And so this was left as standby. And now once the labeling is implemented, we're going to resume the process. But there's not going to be foods with two cautions signs. I'm sorry, I spoke too much. Okay, thank you very much, Gabriela. So if you all agree, we will have a quick 5-minute break so that we can come back 11:43, 11:45, and we will come back with a presentation by Ecuador. Is that okay? So I'll see you very soon. Thank you very much.
Hello, everyone. I hope you are able to stretch your legs and, have some drinks. So our agenda still has 5 speeches from different countries. I'm going to welcome Yuridia Torres from the Ministry of Health of Ecuador. Thank you, Yuridia, for your presence. Good morning. Thank you so much, Lorenza. It's such a pleasure to greet you all on behalf of our Minister of Health, Dr. Jimena Garzón. She requested me to share this space with you today. Let me share my screen. I believe we can see this, right? Yes, we're ready. Let's share a little bit of the strategies that in Ecuador, the Ministry of Health has led and we are executing in order to reduce the consumption of salt and sodium in our country. And just some information to comment on the epidemiological scenario that I believe has been approached in all of the other participations. Worldwide, the amount of salt people are consuming is between 9 and 12 grams of salt a day, which is more than twice the recommended ingestion by the WHO, which is 5 grams. The consequences we all know, I'm not going to repeat the same thing. The consequences generated by the excessive consumption of salt and chronic non-communicable diseases like cardiovascular diseases, hypertension, and so on. And these are pathology that require complex treatments that is going to generate a very high cost to the health system. Specifically in Ecuador, we have developed surveys on the consumption of salt. We do have a specific survey that will allow to have a specific reference on the situation in the country. But we do have very important data and some surveys that we've been working in as a country because we do have the Health and Nutrition Survey from 2014 and SANUT, where they have assessed the attitudes of adults between the ages of 20 and 59 regarding the consumption of salt, showing that the majority of the ones who were interviewed consider that they consume the amount quantity of salt, which is 78.2% of these people on the urban areas and 81.6% in the rural area. Considering a minimal percentage of the population considers that they are consuming too much or exaggerated amount of salt. What I was just saying is explained in this graph here with all these data. And we can also see there is a significant percentage, like 16.9% in the urban area and 13.8% in the rural area, that considers the changes are very little. They're still not changing much in the consumption. But it's important to mention that during the law from 2012 that changed this, shows there is a positive perception on the severe causes of health issues that might be caused by the consumption of salt in the population between the ages 20 and 59, which means people think that if they consume too much salt, this will bring consequences to their health. So people who are female, they think about this in 96%, 97% and 95% for men, which has to do with the high awareness from the population. The adults adding salt to their food before they eat or while they eat is 13.6% in men and 13.5% in women between 18 and 44 years old in blue. And we can see that this is disaggregated by age, 45 to 69 in orange, and a broader age from 18 to 69 in gray, which is also including risk factors of non-communicable chronic diseases that was made in 2018 from the Ministry of Public Health. Other data that we are counting on is the prevalence of the consumption of processed foods that are rich in salt, how they're being consumed equally in the different age ranges. We can see how these are mostly consumed by people who are much younger, between 18 and 44 years old. Well, in this sense, based on the data that I've just shown you, which is available and that we've been working on, we can highlight that this consumption of salt excessively in the country might generate many problems. In order to do a reference, the hypertension diseases, they affect between 1 and 5 adults between the ages of 18 and 69, corresponding to 19.8%. We highlight the negative aspect of this data because there is a high percentage of people who are not diagnosed in this theme of blood pressure. Only 1 in 4 people with hypertension who knows their diagnosis will receive treatment. And this is data established in the STEP survey from 2018. A little bit to advance on the theme of strategies that we have implemented in Ecuador to reduce the consumption of salt with all this information I just mentioned. We have the improvement of the food surroundings in school scenarios. We do have the organic law for food for in schools, and this has been approved in the past few years. We have the regulation approved since 2020, and we count on a regulation for the control of working of school bars and the national system of education and its respective instruction, which establishes mainly the prohibition of sales of foods that have high amount of salt, sodium, sugars, and fat. This instruction has been applied successfully in the past few years. We've had changes. The past one was in 2020 in the regulation, which has allowed to improve the food surroundings in school settings in our country. Another strategy which has to do with the nutritional information when there is high content of sodium, not only sodium, but also fat and sugar. In the processed foods, we have a ministerial agreement since the year 2014, where the parameters that are mandatory were established for food that is produced nationwide and that is coming to the country as imported, with the purpose of providing the right information for the consumer so they can take care of their diets. This is well understood by the population through the signal method. We also count on the food guides that were launched by the cooperation between the Ministry of Public Health, the Ministry of Social and Economic Inclusion, the Ministry of Education in the country, as well as the Ministry of Sports and the decentralized autonomous governments. This is since 2018, and it has 11 key messages. For instance, message 7, as you consume less sugar, salt, and fat, we'll have a much healthier life. And finally, we have a strategy that is called nutritional responsibility for restaurants and cafeterias that we have implemented since the year 2017. It's an important recognition that is voluntary that the restaurants and the coffee shops, they decide to comply with, and this is the Ministry of Public Health that grants the certificate. And the idea is that they all have the proper information to help the consumers choose what they're going to eat. Here you can see the criteria. For instance, on the right, we have this letter, the sign, where the restaurants are going to indicate what the consumer is going to eat. And it could be a restaurant or, I don't know, a restaurant or a lunch place, a food where people can eat food in the places, so they're going to request the salt only if the clients demand it. So this is another strategy that has been very, very important. We have more than 600 restaurants and other establishments that have adopted this procedure, and we would like to strengthen the strategy this year even more. Well, as the main challenges, we have several, plenty of, and I'm going to share just a couple of these challenges with you, because to keep developing rules and regulations that are going to be leading information to the consumers of food, and in a way that there is no overexposure in the supermarkets with high processed foods, which is typically full of salt, sugar, and fats. And also educate the population that we already know that the education is fundamental, and being able to educate the population on the food they should eat, always choosing natural foods or minimally processed foods. And well, also dealing with the mindset of a population is part of the determination that the reduction in salt is necessary not only for people who are sick or with hypertension or the elderly, but we should believe that this education on the population, that should be raised awareness on how the reduction of salt and fats is good for the whole population. We also have as pending tasks or future agendas that are proposed, which is to measure and monitor the consumption of salt sodium in the population. Some investigation is more specific than what we currently have. Also to perform studies on the quantity of salt in the processed foods in the Agency of Sanitary Regulation that we have in the country, which is ARSA, which is subordinated to the Ministry of Public Health, and to establish or improve what we already have on the regulations and labeling of foods that are processed, including the code that signals the dangers of the critical nutrients that are present in that ultra-processed food, and review their purchases. And we do know how complicated this is, especially to fight with the processed food industry, but we must do it. Well, I think this is all from me. Well, yes, and finally, we would also like to highlight that to have healthy eating during pregnancy and the first years of life in order to foment habits that involve low consumption of sodium, coordinate the ministries of the government involved in the sense with the Ministry of Education, the Ministry of Sports, with the purpose of fomenting the food education I mentioned. I also mentioned to change the rules for labeling processed foods and also regulate and control advertisements and promotion of processed foods, of protecting especially children and teenagers, and to elaborate a proposal for the future that will allow us to elaborate a proposal for a law on taxing higher taxes on food and beverages with high amounts of sugar, fats, and salt. This already exists, but not through a specific law. Is the theme of contribution of sugar and sugary drinks. This is already being taxed, so salt and fat should be included and incremented. This is all from me. Thank you so much for the space to share these experiences and also learn from the experiences of other countries. Thank you very much. We thank you, Yuridia. Thank you so much for your presentation. It was very clear. We are running a little late in our agenda, so I will have to request the next presenters to pay attention to time. So the next one is Zaira from Mexico. Thank you, Yuridia. Can you please stop screen sharing? Let's see if Zaira is around. Thank you. Hello, Zaira, how are you? Very well. Good morning. Such a pleasure to see everyone. I was missing you already. Yes, we miss you, Zaira. Okay, yes, please. We're going to listen to you. Let me go fast and short. It's very interesting what other countries have done, and thank you so much for your meeting, because especially for us to modify and to do this action and these policies, thank you for the Ministry of President Pajo.
Well, soda consumption in Mexico, we can see that in several studies that we had, the average consumption was 3.49 grams per day, and there are differences in other countries. Here in Mexico, the consumption is higher for men, more so than for women, and here only 10.6% of the population had an intake that was within the recommendations. 45.4% had high intake and 44% had excessive intake. So we also have this problem of excessive sodium intake. And according to the Insanut Health Service from 2012, the intake on the diet, the highest was because of soups, creams, and pasta, broth, also cooked rice or pies or sandwich, and also bread. We saw that it's similar, the consumption for other countries. And in other studies, we also found that one of the main sources of sodium in the foods was processed meats, bread, as I mentioned, 48.3%, in salted bread, and sweet bread, 7.6%. And as you can see, the consumption of tacos, because it's one of the things we enjoy the most in Mexico, and natural cheese, 5%. And also the highest intake is in processed foods, in which you can find most the amount of sodium. And in a study that we had, a quality study done, assessment in 2021, we can see that the highest consumption was for dressings as well, chilies, canned chilies, and other seasonings and hot chili powder that you can see. Regarding hypertension, since we have this high consumption of sodium, we have a problem with hypertension in the country, and in the population of 20 years old or older. We have here a comparison between the surveys of 2012 and 2018. We had an increase here, the total number of people, 9.3 million people. You can see that that in 2018 went to 15.2 million people. And you can see that as people get older, you have more percentage of people with this hypertension diagnosis. And starting at 50, it gets to 26.7%, and 70 to 79 years, so that was also data from 2018. And so what strategies we had in Mexico? Well, since 2010, we began with public policy, with a national agreement for health for foods, and then we had guidelines for school food and for the sales and preparation of food. In 2011, we created a program called Mexico Sano, Healthy Mexico. In 2012, we had an update of a norm 043 for food guidance. And in this year, we had an agreement for the recommendation of the reduction of the use of common salt and sodium in the preparation of bread. In 2015, Mexico did not have food guides, but then in 2015, these food guides came to fruition specifically for the Mexican population in the context of overweight and obesity, and a campaign was created in the city of Mexico of less salt, more health. That's similar to what many countries mentioned a few moments back. Also of removing salt shakers from the tables in restaurants. In 2014, we only had a frontal labeling for food guides. In 2014, there was an update in the alignment and the orientation for schools. And they were in agreement, and there were criteria that was adjusted, and you had a reduction of products in schools. And we began with 3,000 products, and we ended up with 300 products that could be sold to schools. And this was because they were doing changes in the products. Otherwise, they could not be sold. In 2013, there was a national strategy for the prevention and control of overweight and diabetes. It had different pillars: the promotion of health, medical attention, and different strategies that were done during the previous administration for that. In 2020, lastly, we have a new labeling. And here, fortunately, thanks to Chile, we followed the labeling, and now we have the seals here in the front, as you can see. And here we have the nutrition and food criteria of PAHO. And here, 2020, 2024, we have a specific program, which is public health policies and promotion for the health. And here also, we have a lot of strategies to certify environments that are healthy, and the priority is school and also work environments. In 2022, we are updating the norms. We are updating the food guides that we had from 2015. So this work is being done and being coordinated by the Public National Health Institute in different moments. They are updating this normative, and also the norm 043 is being updated. That's going to be aligned with all of the criteria of the food guides. So more specifically, what were the activities that were carried out according to the strategies that I just mentioned? Well, in 2010, ANSA had one of the objectives, which was objective number 10, which was to reduce the daily consumption of sodium, reducing the added sodium, and increasing availability and accessibility. So what was the action that they had in mind? Well, to come up with a norm to regulate sodium values that unfortunately that was not met. This objective was not reached. We also had an agreement for salt in bread with a recommendation to reduce the content of salt to make bread, either for the bolillo, as we call it, because we eat that a lot, and also pan de caja, another bread, which was reducing 10% the amount of salt. This was voluntary. However, there was no follow-up on that. And as I mentioned, the norm 043, which was for food guidance, this is what we were based on for all the other recommendations in Mexico. Here, we thought about moderating sodium intake and the different ways to prepare foods so that we can moderate sodium. And in school orientation that I mentioned, this is for preparation and distribution of foods and beverages that are high in sodium. Here we also have nutritional criteria to watch preparation or products given in school so that they're not so high in sodium. And finally, with the newest strategy that we have, this frontal labeling, well, we have these seals. They're known in many countries now. And here we have this regulation, we have this classification of sodium as a critical nutritional element. And I reiterate that this frontal labeling follows the nutritional profiles of PAHO. We have a group of HISAMAC. They have several institutions or associations that tackle different themes on food, nutrition, environment. And here is where we have the update of these food guides, of the norms, and all of this based on world and national recommendations for sodium. And we also have the regulation of the content in prepackaged products. Another strategy that we have to reduce sodium intake is this national strategy for healthy food. This is ongoing. Here we're going to have measures for the Mexican population so that they can make better and healthier decisions when they consume foods and when they can buy food. We're going to have a national campaign for that. I believe this is going to strengthen all of the strategies, all of the other strategies, because sometimes or many times the campaigns are done by the Health Secretariat of the Ministry of Health. And here the advantage is to have an intersectorial work so that you have these strategies, and this helps us reach more people. And this is also going to focus on school environment, in particular, talking about frontal labeling. We're going to have publicity for that as well. We will also have a healthy food campaign, as I mentioned, with the frontal labeling, because since 2020, we have this frontal labeling, but we have not done campaigns for people to know that. People have seen the products, they have seen the seals, but we need to strengthen that. And that's going to be done by means of the fact that we will inform people of these seals or of this front of package labeling. And we also have this program, as I mentioned, public health, public promotion. We began in 2020 until 2024. And one of the objectives is to promote health and to have better health by means of education and promotion of health. And for that, we have many norms, many materials, but we need to raise awareness by means of education and promotion of health. So this program is also very important in the country. And with that, we are going to be able to reach the population with all of these public policies. And also to promote healthy competences for the population. And as I said, certifying spaces, important spaces. So schools, we need to certify them as promoters of health. And one of the priority themes is to certify these healthy environments so that a few strategies can be done in those places for those foods, so that we can give this orientation and moderate consumption of salt. And challenges, well, we have many. And one of them is to have a legal framework to support and facilitate these public policies for reduction of sodium intake. We've done that, but we still don't have this legal framework. Another one is to generate the intersectoral and interinstitutional commitment to achieve these agreements and alliances and partnerships so that we can have the cooperation of the food industry that has been shown to be the most complicated thing in Mexico and in many countries. And also another challenge that we have is to transform these food surroundings and environments so that we can increase accessibility to healthy foods, since as we could see, the highest intake is in ultra-processed foods. So we have this challenge ahead of us to increase access to healthy foods. And another challenge is to reinforce these educational communication campaigns. For our future agenda, well, we would like to measure and monitor salt intake in the population. This is something that has always been our Achilles heel, you know, to monitor everything that we've been doing. So this is for future agenda. Also to promote reformulation of food so that they have less salt, and also establish effective and exact norms for the labeling and the promotion of food products. I hope I was clear. I did not want to take too much of your time, so thank you very much for your attention. Thank you very much, Zaida. That was great. It was wonderful to listen to you. And so we will continue, and then we will have a future round of questions if anyone has doubts. So let me see. Now I think I will invite Virginia from the Ministry of Health of Uruguay. Virginia, hi. How are you? Hi, how are you? I'm good. Thank you. I'd like to thank you before anything else. Thank you for the opportunity of being here and exchanging experience with all of you. For me, it's been a place where I learned a lot because, you know, many times we think about things, but, you know, other people are doing that. And so how did they do that? And how are they doing something else? So it's wonderful. And so thank you very much for the opportunity of being here, sharing with you and learning from you. I apologize if there's any interference here in the audio, but the workplace that I am, there are other activities and maybe there's a bit of noise. And if you would understand anything that I say, please let me know. If I'm not mistaken, we are a bit behind in time, right? So I'll try to be, I'll try to speak as fast as I can. Can you see my screen? Thank you. It's not in presentation, full screen mode. It's not in full screen mode. No? Do you see that in presentation mode? No, we don't have that in full screen. We had that issue with other presentations. I think we can do that as Elisa as well. If you increase a bit, we can see that. Is that done now? No. I'm going to try and do another test. Virginia, try to do that before in full screen. Now, is that okay? Yes, now it's perfect. Thank you. Yeah, I have a new operational system as well, so this is another difficulty. So it was good that I could do that. All right, so to talk about the themes that were mentioned before that we should share, we have the epidemiological scenario that was asked of me to speak here. So in Uruguay, we have worked on salt reduction. We don't have a survey for the consumption of foods in our country, but what we have at this moment is apparent consumption per person. And as you can see, the last data that we have, they're very new because they have just been analyzed. They are from 2016 and 2017. And the statistical analysis was done now in 2021. So those are in terms of what families spend in homes. And based on that, we can identify the brands. We can do an analysis of what the family is consuming. Obviously, it's apparent consumption because we cannot see specifically how what's bought by families is actually consumed. But this has given us 8.3 grams of sodium, which was something that we saw in other methodologies. On the other hand, in terms of children specifically, from 4 to 12 years old, we had a study done, a consumption study, and in reality, we saw what the children were eating. And in school food program and in their homes, we also did that in 24 hours. We did a survey and we saw that they were consuming 2 grams a day. This assessment gave us means to have strategies and policies because those children who ate in this food program, they had a better quality of food and less consumption of sodium and ultra-processed foods. And we also saw children who went to schools, but they did not use the food programs. So in this sense, we know that we are consuming more. And part of that is a result of the analysis of this study. And we have 25% of the calories in the consumption that are destined to ultra-processed foods.
Yes, the vast majority of the sodium consumed in the country does come from ultra-processed foods and also the salt that is added to the preparation. Uruguay and other countries in Latin America has a consumption of food that is not ultra-processed, but is a food eaten outside of the household, which could be in a bar, a restaurant, a canteen, a fast food chain, where we are also looking at a large concentration of consumption of salt. When we're looking at how this reflects in those pathologies that prevail, especially when related to sodium, like hypertension, we see that 30% in a population from the ages of 15 to 64. But if we look at the younger population, a small number, 25 to 64, will be almost 40% according to the previous information. This repeats in this study here from 2013. So we do believe that this could be the same, or it could have increased, considering we do not have all the data on overweight and obesity in the population. Only that 6 in each 10 Uruguayans have been following those figures, so probably they have increased. Talking about hypertension in children, the study on blood hypertension, we have a connection with overweight in children between 10 and 13 years old. This is 3 years old now. 7.8% of the children had hypertension, which is quite a concerning piece of data, which alerts us to keep working and looking for strategies. And if you observe this age range, the consumption of sodium in this age range of kids that are older, and you look at the percentage of hypertension, this shows an important work that we should do. What are the strategies that were presented in Uruguay? The strategies, the previous ones that were seen, they have one first, the frontal label in the decree 272 from 2018, which presents octagons in the labels of foods to alert the consumer so he can better choose the foods they're going to be buying. This is effective since last year, but we do not have the data on its impact, nor the monitoring and inspection that was done. We are still in the process because, as you do know, in our country, the first decree is from 2018, in which they were giving some time so that different companies could adapt their products, but they have two most recent changes. And in this moment, we have the decree 272 that is valid at the moment, and we also have here the change in the Annex 74/021, where you have a change in the limits in the quantity. So this took 1 year to implement. And in this direction, other things we have done in order to consolidate more of this policy and extend it for the rest of the strategies and public health policies is that the law 1940 for healthy eating in educational centers has changed. So the education centers cannot sell any foods that have the octagons and also limit their consumption by the children. Of course, there is no rule that allows to eliminate completely this, but part of the objectives in this period is to be able to change the normative so it's more restrictive, basing ourselves in the octagons, and one of the central octagons that can be clearly seen is excessive sodium. And we have the food guide from 2016 that like many other food guides in the region has in them the concept of ultra processed and the concept of changing the eating habits towards minimally processed food that have less concentration of sodium, and what we use in the food guide to facilitate the interpretation that I have just shown you. The food guide has this characteristic of having a kit so the health team can work with these tools by using one of the components of the kids, and how there is this feeling that salt gives to food, so you can easily identify if salt is added in excess there. So it's important to educate the population that many times we look at this and think it's really clear, right? But for this to reach the population and to cause a reduction is more difficult. So within the strategies for sodium reduction, when used together with others, shows this trend that in Montevideo there was a prevention of the use of salt shakers and access to salt in different restaurants, cafeterias, and snack places. And we do have other foods that have like an option that they can use. While when people want salt on the table or another type of condiment, they should be expressively requesting the waiter or waitress so they can get it. A resolution from 2018 shows that 10% of the dishes offered in the menus of restaurants, canteens, or bars should be without salt. It doesn't mean that there is no salt in the salad, right? These are dishes that are elaborated without any salt. So these are decrees and resolutions that are for the municipality of Montevideo and the state or department of Montevideo. So we cannot extrapolate the data and we cannot evaluate these changes. But this idea of removing salt shakers and condiments from the table, the population resisted for a while. But what actually happened later is that some started to understand the importance of these characteristics because this was happening in a certain way that could generate benefits of having one option without any salt for those people who are already following this diet or that often do not consume salt. On the other hand, like many Latin American countries have commented, the strategy less salt means more health, which is a substitution of salt in bread, which has a very profitable stage of years ago working with bakeries in Montevideo, which is the capital of the country, and some other bakeries in the countryside. And then after a while, it was not possible to continue because there was no agreement at the time. So we're restarting the articulation with the Commission of the Cardiovascular field and also the Department or State of Canelones, so they can start a strategy that will slowly expand to the rest of the country. Canelones is an area that is quite sensitive and we have been working there, so this is a good place to start the strategy. On the level of the research that was done around the country, looking at the percentage of reduction of sodium that would not be perceived by the consumers. So these works are plenty on the international level, and these can help us start with a reduction that won't be perceived, or the taste of people for that kind of food. But what we do need is for the sales to maintain themselves. So the members of the articulation that is voluntary can maintain themselves and keep participating in order to achieve some things that I'm going to discuss in a minute. We have this process right now of construction for small and medium enterprises on the labeling and reformulation of foods, and the Ministry of Public Health and the Technology Lab of Uruguay is participating. It's a guide with a focus not on the large food industries, but the little ones, the small companies that are looking for a reduction on the critical nutrients, between them sodium, not only sodium, in order to provide strategies to do this and to help identify where they can go to get assistance in this. So we have here these partnerships that will allow tools for this kind of company, which not often has resources to make changes, financial resources to hire the personnel for that. So often these kinds of companies, they do more local sales or shorter circuits of sales. So we want to be able to focus more specifically there. For us, anyway, we still have not finished with our national sanitary objectives, but the line of action number 8 is very much focused on the reduction of the consumption of sodium. For the ministry, it is central to be able to emphasize it. And as you can see, many of the policies, strategies, and programs we are working on are related to changing the surroundings and working in the food systems. These are perspectives we're taking into account to consider the strategies we're going to be performing and how we're going to guide these strategies with a focus that allows an approach from different places. What are the main challenges here? One of our main challenges that we are working on is to make a consumption survey. What we have right now for the baseline is the apparent consumption data. We do know we have an excessive amount of sodium in the apparent consumption, and more recent data has focused on ultra-processed foods. So we have a survey for consumption, which is very important for us. We're also in the process of evaluating. I'll pass the floor to Leo, who is an assistant in the program of nutrition themes of obesity, to summarize the document. Thank you so much. I was in a different meeting. I'm sorry. Okay, no problem. Okay, it happens. Okay, it happens to everyone, you know. Don't worry. Please, Virginia. Okay, developing new normatives. And in this context, we're following the same strategy. And we are proposing developing new normatives for the reduction of sodium. And in this sense, with the new normatives, we have a working plan, which should be doing some analysis on the chemical composition of products in two dimensions, in the direct analysis and for the study of front labels and monitoring and inspection, and to have a database of the chemical compounds in products. Then now we have 2,140 products that we're going to start studying and analyzing to identify and make a ranking that is necessary to build a normative around the recommendations that will help reduce gradually. Why am I saying this now? Because part of the previous strategies were still looking to get salt from different places. Reducing the salt and bread through voluntary strategies involves working in these limits. And the main challenge we have is adherence to the food industry to different programs and strategies. At some point, I'm sorry, I don't remember who it was. You should be sitting on the table for discussion. And yes, everyone should sit for this discussion. Centered in the conversation and in certain aspects, assuming this is for the general well-being of the population to reach reduction in salt. These are very complex challenges that are normative challenges. It's hard to get adherence because nowadays, they're not complying too much with the frontal labels, but there are voluntary elements as well. And the voluntary elements are also complex in the adherence. And in this case, with the food industry, we can also be thinking of different restaurants, rotisseries in the country producing foods that we would like to request the amount of sodium they add to their products. So the adherence of different actors in the food system and what it is, the consumption of sodium, is important and difficult to achieve in many cases because in some cases the benefits are not identified. It's more like control or an extra problem to face, especially when we're talking about food preparation in a restaurant that could have benefits, but if they suffer some pressure and the population does not agree, they won't adhere. So the reduction of the consumption of salt needs a focus, which is broad, which in reality follows and progressively leads to a reduction, and by reducing the taste for salt, this threshold that the person perceives as something being saltless because they're used to it. These are future agendas. Some of the things that I already mentioned are here to present to the Honorary Council of Coordination of Policies that are aiming to tackle overweight and obesity, which has this idea of organizing a technical team which will elaborate the proposal from the analysis of ultra-processed foods in the database I was commenting, and start working and identifying limits and proposing what would be the stages for sodium reduction. This year, we have this normative being rewritten with all of the process ending and in the end of the year or in the beginning of next year, we're going to present it to seek approval. In our future agenda, we also aim at expanding strategies that is happening on the level of the different departments, like removing salt shakers and 10% of the menu without any salt, and expanding this to the rest of the country, because now we're doing this only in Montevideo. I tried to see as if I was speaking as fast as I could. I apologize. Thank you so much for the opportunity to be here. In case you have any doubts, I'm here for you. Thank you, Virginia. I do apologize for rushing you, but I think the network is there for this, right? We would like the countries and representatives to connect in case there are any doubts, or if we had to talk more about policies. I am sure we'll have plenty of opportunities. Now I will pass the floor to the representative of the Ministry of Health of Canada, Constantinia. It's a great pleasure, Constantinia. It's the first time you participate in our network meeting. You are very, very welcome, and you have the floor. Thank you.
Thank you very much for the invitation to participate in this webinar, and good morning to everyone. So I will start by sharing my screen. Okay, perfect. So again, thank you very much. And, I will give a brief presentation on the sodium reduction initiative in Canada. Maybe I will pass the outline for the interest of time. And going the epidemiological context slide, I'd like to underline that poor diets are a primary risk factor for chronic disease. Diets high in sodium, saturated fat, and sugars are linked to obesity. And for that reason, there is a great interest to reduce this. Cardiovascular disease is the second leading cause of death in Canada after cancer. About 34% of deaths from cardiovascular disease in Canada were attributed to dietary risks. Furthermore, 1 out of 4 adult Canadians live with high blood pressure, with over 70% of those 65 years and older being affected. Excess sodium intake increases blood pressure and consequently increases the risk of cardiovascular disease. An effective way to reduce sodium intake is through lowering the sodium content of processed foods and commercially prepared foods, as most of the sodium we eat here in Canada comes from these foods. So this slide shows Health Canada's healthy eating strategy, which was launched in October 2016. It has 3 pillars and aims to improve first the food environment to make it easier for Canadians to make the healthier choice. And it includes initiatives like to promote better nutrition information. Second, to protect vulnerable populations, such as the initiative to restrict marketing to children. And third, to improve food quality, for example, the ban in partially hydrogenated oils and the sodium targets, which will be the focus of today's presentation. I'd like to provide an overview of sodium-related initiatives here in Canada. So sodium is one of the core nutrients which must be declared on the nutrition facts table of prepackaged foods. So the absolute amount of the sodium, including the percentage daily value, must be declared. And also there are 6 nutrient content claims related to sodium, such as low in sodium, reduced in sodium, sodium-free, etc., salt-free. There are specific criteria that must be met so that these sodium content claims can be made on packaged foods. In addition, there is one health claim related to sodium and potassium content in foods and the reduction of the risk of high blood pressure. In 2016, the department published revised regulations to improve the nutrition facts table and the list of ingredients of prepackaged foods that will help Canadians make more informed food choices. You can see an example of the updated nutrition facts table on the screen. The revisions included making the serving size more consistent and more realistic of what Canadians eat, revising the daily values so they are based on current science, and also adding potassium in the list to the list of the core nutrients, and which must be listed below sodium in the nutrition facts table. There was also the addition of a footnote at the bottom of the table to help Canadians understand how much sodium and other nutrients, like sugars, for example, are in their food. It explains that 5% or less is little and 15% or more is a lot. In January 2019, an updated Canada's food guide was released. It includes key messages related to sodium. For example, prepare meals and snacks using ingredients that have little to no added sodium, or choose foods that have little to no added sodium, sugars, and saturated fat. To address the high sodium content of processed foods, we published voluntary sodium reduction targets for processed foods. I will give some more information about this in the next few slides. There is also a proposal to require a high-in symbol on the package of the foods, and the high-in symbol will relates to the content of saturated fat, sugars, and sodium, so consumers have a quick and easy information to make healthier choice. And last June, we made a proposal to amend the daily values for sodium and potassium declared on labels to align with current science, the 2019 dietary reference intakes for sodium and potassium. On this slide, we can see that Canadians consume too much sodium. Because most of dietary sodium comes for processed foods, to address Canadians' excess sodium intake, in 2012, Health Canada set voluntary sodium targets for many processed food categories to be met by the end of 2016. When intakes were established in 2017, we evaluated that on average, Canadians consumed 2,760 milligrams of sodium per day. And this was based on national surveys, recall surveys of how much Canadians ate the previous day of the call, and also on composition data from sodium levels from foods available on the Canadian market back in 2016. So we found that even if it is less sodium than previously reported in 2004, which is 3,400 milligram per day, this is much higher than the recommended adequate intake. It's still above our intake goal of 2,300 milligram per day. In fact, 3 out of 5 Canadians aged 1 year and older, and 3 out of 5 children between the ages of 4 and 13 eat too much sodium. And males eat much more sodium than females across all age groups. So based on our modeling analysis, sodium reduction in processed foods only contributed to 8% reduction in intakes between 2010 and 2017. So continued efforts needed to decrease the sodium in Canada. Many food categories contributed to sodium intake. So the top 6 sources of sodium here in Canada are bakery products, similarly to other countries, and this is followed by appetizers, countries for foods like pizzas, French fries, etc., and processed meats. So these 3 large categories make up for half of all the sodium Canadians eat. Other major sources include sodium, soups, sauces, and condiments. So in this slide, I'd like to talk to you about the Health Canada's voluntary sodium targets, which were revised back in 2020, and we asked industry to meet this by 2025. So the targets are very similar to those published in 2012. So it's our second set of targets. They continue to apply to processed foods sold in retail outlets, as well as those destined for further processing, such as ingredients and ready-to-serving items sold to restaurants or food services. And these revised targets build on those published in 2012. But in some cases where we created new categories and revised the targets to account for technical challenges, or adjusted or split the categories to provide greater refinement. So to encourage a reduction in the saltiest products in each category, the 2025 maximum level targets were set at the 75th percentile of the category data from the levels we surveyed from the foods available in the market back in 2017. So this acknowledges the progress industry made in reducing sodium. The targets continue to have the same components: a sales weighted average that applies to the category and a maximum level target that applies to individual levels, to individual item foods within a category. Overall, the adjustments have resulted in an increase of the target categories from 94 to 117. So I'd like to talk about some challenges and lessons learned. So we know that sodium is everywhere in the food supply. So the targets should cover the majority of the sodium containing processed foods. We used market share data, national nutrition surveys, sodium levels from packaged foods. So we have actual and representative data from the Canadian market. As we know, gradual sodium reduction is important for consumer acceptance of less salty foods. So setting voluntary targets provides flexibility. It allows for regular revisions and refinements to targets. Setting food targets by food categories, provides specificity. So we learned that grouping foods into less broad and more specific categories allows for more realistic and meaningful targets. It is also important to set a sales weighted average target based on market share data for the category. We consider that it is considered, in fact, the gold standard because it reflects product consumption more accurately than a simple average. It's setting a maximum level target for individual foods to encourage a reduction of sodium in the saltiest products in a category is important. Engaging and consulting with stakeholders in setting targets to understand and address challenges in sodium reduction, it is an important part of our initiative. We have done extensive review and modeling to experiment with food categories and subcategories on how the data were clustered within the overall categories to identify trends and outliers and to determine an appropriate target for the category or the subcategory. So monitoring and evaluation and reporting of progress in reducing sodium in foods and in intakes, we believe encourages continued efforts in reducing sodium. Finally, comprehensive, representative and up-to-date food composition data are needed. And this includes market sales data. So maintenance and cost of data is challenging because there is a big turnover of packaged foods on the market. So in finishing, I'd like to summarize some important future milestones. In addition to voluntary targets for processed foods, lowering the sodium content of food sold in restaurants and food service establishments also plays an important role in reducing sodium intakes in Canada. The department plans to consult on proposed draft sodium targets for this sector, but due to the impact of the COVID-19 pandemic on restaurants and food service establishments, the consultation has been delayed. So we plan also to monitor progress towards achieving the 2025 voluntary sodium targets for processed foods around in 2026. And we will report on progress towards meeting the goal of population average sodium intake of 2,300 milligrams per day. If you like to have a little bit more information about our initiatives, I invite you to go to our website, which is you can see on the screen, canada.ca/sodium, or you can contact us by sending an email to the address that you see on the screen. Thank you. This ends my presentation. Thank you.
Thank you very much, Constantina. Thank you for your presentation. And now, as you can see, we have a few minutes left. I'm going to ask Anilda to do the presentation of Uruguay. And I saw that Dr. Adriana has a question for Constantina. We will see if there are other questions, and then we can make a proposal to maybe close, because we won't be able to present our work plan as predicted, but we can stop and is Nilda here from Paraguay? Hi, good morning. Can you hear me? Yes, we can hear you. Do you have a presentation? Yes, sorry. I know we don't have much time, so I'll try to be as brief as I can. Thank you for that, Nilda. And I ask you for your patience. I think we will be 10 minutes more, and then we will try to close our session. Thank you, Nilda. Nilda, we cannot hear from you. I think you're muted. We can see your screen, but we cannot hear you. Now can you hear me? Yes. All right, so I will keep my camera off so that you can hear me well. All right. So we are now currently part of, we're not part of the network currently, but I'd like to thank you for the space for us to share what we're doing. And also it was great to know the experience from other countries so that we can also strengthen our actions. And let us consider the possibility that we might be welcome as well in this network. So a bit of the epidemiological scenario in Paraguay, the non-communicable diseases represent the 5 top causes of death, and that gets to 15,000 deaths a year, and more than half of these deaths were of people who were younger than 70 years old. And we can say that we have adults and young adults with non-communicable diseases and with high mortality. The cardiovascular diseases, they are still the main cause of death for many years now, with almost 27% of the total of deaths in 2017. Arterial hypertension is the main cardiovascular risk factor, and for the Ministry of Health, it's a challenge because it represents 48% that is associated to the morbid morbidity for cardiovascular disease and kidney disease. We know that the sodium dietary intake is one of the main causes of the increase of the arterial processes, and according to our next done in 2015, we saw that we had the increase because of lack of physical activity. You had 75%, and with improper food, 84%, and the consumption of alcohol, 51%, and that is associated to overweight and obesity in 57% of the population.
We have a study that was made in the year 2014, and we can observe here that the consumption of salt in 24 hours is higher than the consumption which is recommended by the WHO. In the same survey that took place in the year 2011, we can see different results that we obtained while the population is adding more salt in the kitchen. They actually are adding salt without tasting it before. So we can also ask at the question, how much do you believe you take? And it shows their perceptions on the consumption of salt in Paraguay. We do know that 5 grams a day is recommended, but in this study from 2014, it found 13 grams, actually 13.7, which is almost 14 grams of salt a day in the population. In 2018, we participated in a multi-centric trial in Latin America to assess the amount of sodium in the processed foods and locally consumed as well, like those that are sold on the streets, and fast food and artisanal foods that we, as a country, we also have a culture, which is a Paraguayan soup, La Chipa, and all these other artisanal foods, and also those that are packed, we can observe an average of sodium content above 3,500 milligrams per 100 grams of food. When it comes to the strategies, we have the National Plan for Actions in Non-Communicable Diseases that has as a purpose to reduce morbid mortality caused by these diseases and achieve 25% in reduction of these premature deaths. We have the initiative Less Salt, More Health for the reduction of the consumption of salt and sodium in Paraguay, which is developed in the National Plan for Action, contemplating the 4 axes, the regulatory mark and normatives for the reduction of the consumption of salt, and also the reduction of content in the artisanal bakeries. A study that was shown in the slide before that showed the sodium content in food and everything related to information, communication, training, surveillance, and so on. And this initiative has been strengthened with a line of action of surveillance and investigation through the information, communication, and education through spreading results obtained through the investigations. We also have a platform of intersectoral collaboration where we have the Ministry of Public Health and Social Wellbeing and municipalities and governments and associations of bakers to form a strategic alliance, which is very positive. When we started in 2013, the theme of sodium reduction was also taken to the bakers and also the supermarket chambers, universities, and NGOs in order to strengthen all of this part involved with education in the industry in Paraguay. I believe there is a microphone open here. Everything related to the companies and collaboration between scientific societies to give us all the support. We have this resolution here from the year 2015, establishing the parameters of the content of salt in baked products of massive consumption. We selected 4 to 5 products where you have all kinds of local breads, preferably those that the population buys the most, because this is what we consider to be the mostly eaten, especially for people who buy it in wholesale. As another strategy, we look at the colleague countries in Mercosur that already have their frontal labeling rules and laws and for packaged products as well. We are now looking at this project for the law to be sanctioned in our Chamber of Congressmen and Senators that already prepared the joint project with the technical areas of the Ministry of Health, and we are now in the process of obtaining this law approved for the frontal labeling of foods. We're having talks, we're having trainings at the universities, at the schools, and the population as a whole through our Paraguayan food guides that are towards a healthy population. So in these food guides, we have a specific aspect about the consumption of salt with iodine, which is what we emphasize that should never be higher than 5 grams a day as recommended. It's critical to have this healthy goal, and the INAN website has more educational material that we have regarding nutrition and healthy eating. We are having a summary here about the actions when it comes to the strategies already mentioned before. When we have the normatives, we have the municipal ordinance to remove the salt shaker from the table in the restaurants. And this is for the responsible consumption of salt in gastronomic settings. And this aims at regulating for the population regarding the consumption of sodium in Paraguay, which was reduced. I also mentioned the normative and the resolution and the reduction of the consumption of sodium in baked foods. And then we have the surveillance being done until 2020 in different departments in the country, where 53.6% has become adequate to the norm, which is 600 milligrams of sodium per 100. This is a summary of what we are doing as surveillance and part of the surveillance of food that are going through this yearly monitoring, which is random inspection of baked goods. And we are trying to control them so they don't go over what the resolution establishes right now. So we can see that the types of baked goods are rosquita, potato, pan Felipe, the French bread, as we call it here, the population knows as pan trincha, y galletas, which are cookies. This graph shows the average and the median of sodium in baked goods. And we can see from the year 2014, when the median started with 499, and in 2017 it increased, but then it lowered again gradually. When it comes to surveillance and investigation, we have made stronger because of the publication in national and international journals. So after these studies, we can also make decisions when it comes to actions that are nationwide. We also have social marketing for the reduction in the consumption of salt, which is a regional strategy. Also, through scientific evidence, we can strengthen this area. As the main challenges, we have, when it comes to monitoring the content of salt in baked goods, we are going to continue increasing the number as well of samples. So this is a little more representative on the national level. So the same results are also informing the entrepreneurs, the bakers, or those responsible for sales. So they will promote an adequacy to the current resolution, and also so our population is informed about the benefits of consuming these food items with the sodium reduction, which is a strategy to prevent cardiovascular diseases. The approval of the frontal labeling for processed products requires implementing a regional strategy for social marketing for the reduction in the sodium intake and strengthen the physical and human resources in epidemiological surveillance related to the national and local levels of sodium, amplify the reach of the ordinances to more districts of the country, lead an investigation that focused on epidemiological surveillance of sodium intake in the population, increase the number of national and international scientific publications. We are using the international ones as well, focusing on publishing the country's own publications and implementing innovative strategies on the country level for the reduction of the sodium intake labeling. And so the frontal labeling is a good alternative together with the regulation of packaged foods. Well, I tried to do my presentation in record time, and I do apologize if I spoke too fast. So this is where the presentation from Paraguay goes to, and let's just see how it goes. Thank you, Nilda. And I do apologize, Nilda. If the Ministry of Health of Peru confirms an interest in participating in the network, I would like to request you to send a communication for the general communication of food and nutrition so we can formally insert Peru in the network, okay? Paraguay, no, not Peru, Paraguay. I'm sorry, I'm already going crazy, it's Paraguay. Thank you, Eduardo, thank you. Eduardo, can you help me think what we should do? Since we are running late, it's 1:12 right now. Our concern is to present to you an action plan and activities for the network in 2022. And I'm going to ask Eduardo if he thinks he can explain this briefly, or the alternative would be for us to send every representative the information so they can comment. And okay, I would like to do these two suggestions and then you tell me how to proceed, Eduardo. Thank you, Lorenza. I agree completely with your suggestion, and I should highlight that since the main objective of the network is precisely to share experiences, we could not miss this moment after seeing all these presentations to highlight briefly all these common problems and challenges we have between the countries and how strategies are adopted in a way that is common but with individual differences. I would just like to highlight something that is very interesting and compensating for us. It's that how much have we advanced since 2018 in all of the region, not only Latin America, but the Americas in general. It's a global reference in terms of diets and things. So we see a lot of this advancement. And as Lorenza suggested, I believe it is a great idea to send the documents to each of the countries so they can give their opinions and suggestions, and making clear that the working plan predicts we'll have a new meeting in May. So we'll have the opportunity to go back to these discussions after we go to the specific discussions. And finally, I would like to highlight what Lorenza said about Paraguay, which can be extended to other countries in the region. And we do know how much Latin American participation we have, but less from Central America, especially the Caribbean. So our network is open for these countries to join, because an opportunity to have a presentation and discussion on the PAHO website will be very helpful. So I just want to highlight this for the record. We are opening the door to each and every country who wants to participate, because it is really interesting and we want to advance more. And the idea is that it was very fruitful to say these things. We have accumulated knowledge, so this is why the discussion took longer. So we expect to continue and have the same trend for the participants in countries and partners. I believe it is essential for us to push our agenda forward and proceed by supporting one another, and as a group support the policies of each country. Thank you very much, everyone, for your participation.
Eduardo, I'll ask just if you would like to open the camera so that we can take a picture, if you please. Thank you, Jessica. Thank you, Dr. Adriana. We will send the information by email, and we will see you all very soon. Thank you very much to you all, but just a moment so that we can take a picture. All right. Once again, thank you very much to you all, and we will see you next time, and we will be in touch by email. Thank you. Bye-bye.